on fire. Shoulder sideways, smack it in the air. Legs move it side to side, smack it in the air. Legs move it side to side, smack it in the air. Shoulder sideways, smack it in the air. Smack it in the air. Legs move it side to side, smack it in the air. Smack it in the air. Way your hands I choose, I put it in the air. Way your hands I choose, I put it in the air.
Good evening, everyone. Welcome to your daily dose of respiratory talk with myself, Maricela, and Miss Pamela Santos.
Hi.
And this is Jessica Woodward.
Hello.
Okay, let's get this day going.
Right.
You know, as every day we like to start our day off with champagne because and pills apparently.
Oh yeah.
Oh, girl.
This is just my antidepressant.
Oh, okay.
I take one every morning. It is a selective serotonin reuptake. Fucking shit. Going so good. So.
So you're taking an antidepressant.
This is just my antidepressant.
That reminds me of Britney Spears.
Okay.
Oh, there she is, right there.
As everyone knows, that it is a first line of treatment for major depressive disorders because we don't want to end up a Britney 2007.
Right. Nobody wants to be that.
Nobody.
So
please
what
take your
is it?
medication.
An SSR or what?
Okay.
It's a selective serotonin reuptake inhibitor. So it increases your levels of serotonin in your brain.
Okay, and is this for your bipolar disorder? Since you don't know whether you're depressed or maniac, whatever.
Yeah.
What's going on?
No, we all know you're the one on lithium.
Lithium, what's that?
Lithium is an antipsychotic which is used to treat bipolar disorder like my Maricela here has.
Okay.
So it does have a small therapeutic window, I hope you know. If you take too much, you could end up in a coma.
Or even worse.
A coma at St. Bernardine's.
Right, no one wants to end up there.
No one. Speaking of psychotic people, did you guys hear about that guy who ran over like 10 people, killed them because he was a virgin and nobody would sleep with him?
Oh wow, sounds like some kind of psychosis or schizophrenia. I mean, he should have undergone some kind of like reality testing. People who like hallucinate and have like abnormal thought processes.
Yes.
Oh, okay. Or maybe he should have been on a combo of Haldo and Respiratory, which are...
They're antipsychotics.
Oh, just kidding.
Okay.
Well, about that guy, talk about a virgin who can't drive. Oh.
Not my dear friend April, but...
Yeah.
She's pretty.
Well, thinking about being a virgin and not getting any gives me anxiety.
Oh, right.
Try one.
What is that? Is that Xanax?
It'll fix you in a minute.
It is Xanax.
It'll fix you in a minute.
Okay. You need to be careful with that because it can suppress your drive to breathe. Xanax
If taken too many or taken with
an anti-anxiolytic which can suppress your drive to breathe. And you can die.
And that's where respiratory therapists come into place.
Right. Also, they use Xanax for general anesthesia.
Okay.
So, like, I don't know, you get a little procedure.
It makes sense.
A little breast lift.
Gotcha.
Something like that.
Oh, I'm going to need that after we graduate, of course.
Right. Wait till after.
It makes sense. Okay.
Well, you can also use them to fall asleep. Speaking of sleeping.
We have none?
True. True. They use barbiturate drugs.
Barbiturates, yeah.
Barbiturates. Am I still not saying that right?
You never say it right.
I know.
Barbiturates.
Well, it's a sedative, like pentobarbital, to manage your patient who is mechanically ventilated and they're suffering from increased ICP. Another sedative used to treat seizures is phenobarbital.
Oh yeah. Just remember that will also suppress your respiratory system and you could die.
You could die.
And it does also depress your neuron activity. That's why these are very addicting. Somewhat like
alcohol. Well, they could use these to help you sleep, or they could just use the new drug called Ezoclone.
Ezoclone.
For long-term use.
Yeah, because barbiturates, you're only supposed to use them for a week or two. And then you're
okay.
off. You're cut off.
Oh, well, you know
Yeah.
what else people abuse, though? But for pain. But it's socially acceptable. And you don't even need a prescription. Just an ID that says you're 21. Alcohol?
Oh, sorry, Amanda.
Alcohol.
Didn't meet the cut. If you go to Mexico, you're of age.
Oh,
Right.
wait. But she did
Or
have
Germany.
a birthday. She had a birthday in December, right? So she
might
is
have.
21.
You know what? She might have. We gotta
She's
take her down.
21
So you're
now.
looking at
Sorry.
the
picture down.
Sorry, Amanda.
You're looking at the picture
Next
down.
slide. Next slide.
Oh, take it down.
She's lucky enough to stay in the United States and drink legally now.
Oh.
Oh, can we get makeup?
Makeup?
Can we get makeup, please?
Touch-ups?
No one's gonna do my lipstick today.
Jeez.
No one's gonna do my lipstick.
What are we paying you guys for?
Hello.
Oh, thank you. No. Oh, yeah, thanks.
Thank you.
Yeah, I was
This is
getting a
all we can
little.
afford.
I was getting a little shine. That's good. Oh.
All in her nose. Okay.
Okay.
I'm here. We're filming on the set. Filming.
You know what? All this.
The therapist. Monty, get in there.
Give me
Oh, you need a smoke break?
back.
Do you need a smoke break?
Take a picture.
Thank you. Thank you. Can we get done?
Okay, yeah. Let's take 5.
Okay.
Basically, like alcohol is a plain anesthetic. So if you drink a lot, it's like me on a Friday.
Or me every day.
Mm. Right.
But if you combine it with a sedative or hypnotic, it makes it even more effective. Be careful because 400 to 600 milligrams per deciliter can also lead to what? Respiratory arrest. That's what we're here for.
Or-
Respiratory
Again,
arrest.
that's what respiratory therapists are here
Right.
for.
Talk
what we're
about
here for.
alcoholics, man.
That's what we use these things for.
Talk about an alcoholic. You know what I mean?
Oh man, alcoholics.
Let's see. Let's see who we have as our
Oh, if you're admitted into the hospital and they suspect you with DTs, okay, it's delirium tremens, or in layman's terms, suffering from withdrawal. It'll make your central nervous system like overreact, causing you to have tremors. They could possibly even prescribe you with ethyl alcohol drip.
I just want to know where in the hospital is this drip located? Because
Right?
I've lived everywhere while working the night shift and
Now?
have not been able to find
Right.
it.
Seriously, just
I can't.
raid the patient's fridge.
You know
I
what
just
we
have
need when our
beer.
patients are
They have straight
ventilated?
up
We just
beer.
need to look at all their drugs. I'm like,
Yeah.
no.
Right. Minus drip. Sorry. Okay.
Oh my gosh.
Do not work. Let's talk about some pain management because, let's just do
Right.
that.
Because we're all in pain.
And before we talk about the hardcore stuff, though, let's just talk about the light issues, the light medications that are out there,
Sure.
Right.
such as
Our NSAIDs.
solicitates,
Yes.
solicitates, which are your aspirins. Your aspirins are good for some mild to moderate pain, depending on how well you can handle it or not. But unfortunately, they are an anti-inflammatory,
Non-steroidal.
non-steroidal. But unfortunately, they have been linked to Reyes syndrome in young children.
Yes.
Reyes
Ray.
syndrome.
Ray.
Reyes.
Right.
Okay.
Reyes.
So,
Different thing.
those are your good old school drugs. Our other ones are aspirins. No, I'm sorry. I just talked about your aspirins. Let's talk about your Tylenols. Your Tylenols are good for, some, what is it called?
Mild to moderate.
Mild to moderate pain.
Right.
Mhm.
Nothing too
Not an
serious.
anti-inflammatory, but also they do not mess with your GI tract.
No,
So-
that's actually a good thing. But you know what
Very good.
Tylenol does do? It
Is that
messes with
true? I never knew that.
I don't know. I don't mess with those.
Okay.
Okay,
Big
well,
drugs.
it can cause a lethal, Tylenol
Okay.
can cause a lethal hepatic necrosis, so it's really bad for your liver.
Don't take too many of them.
Yeah.
That's what it's bad for, is your liver. I knew it was bad for something.
Right. Okay. So
So you have your two NSAIDs, you have your salicylates and you have your acetaminophen. The salicylates being what?
Aspirin.
And your acetaminophen's being...
Tylenol.
Now
Okay.
that's the baby drugs. Baby drugs.
those are the very baby drugs. Now let's talk about our personal favorites,
Yes.
the
Let's do it.
opiates.
Mhm.
Let's just mention there is a true huge crisis in the U.S. right now. We are at war with opiates, and when you do abuse opiates, It's not a laughing matter.
Right.
And it can lead to this.
The video has been shared hundreds of thousands of times. It happened in the medical district yesterday afternoon.
Police say the teen snorted heroin inside the bathroom at a nearby Walgreens.
Could have died on the side of that road very easily.
2 white males and a female down. Injured. Man, that thing ain't moving.
The heroin takes you to a stage of nirvana.
Is that the guy in the video?
Yeah. A Nirvana type of feeling.
Right.
Our favorite. But if not abused, they are for moderate to severe pain. It is used for that. Meaning.
Oh, speaking of pain, sorry. Last thing. So obviously when we're in a patient's room or our patients come to us in an emergency room, we do look for vital signs, and there's your blood pressure, your respiratory rate, your saturation.
Which always need to be.
Right, but now there is your 5th vital sign. Remember, you guys, 5th vital sign, which is pain.
Okay.
Okay?
And
So-
we need to assume that the patient is in pain.
Yes.
Which is
APP. Assume your patient is in pain.
Right. And pain is technically the 5th vital sign.
Right. Very important. We've said it like 50 million times.
Oh, did we say it a lot?
Yeah,
We
no,
did
it's
say it.
fine. So
Okay.
you just basically APP is assume that your patient's pain is present. So if your patients come in and they can't talk, they're
Assume they're
sedated,
pain.
yes, they're paralyzed, something.
Elevated heartbeat.
Right. So assume that right, that's a good sign that they could be in pain.
Can we talk about those 2 people in the medical district overdosing? What could we have done?
Give them Narfolux.
Right. Exactly.
Naloxone?
It's naloxone.
Naloxone or Narcan.
Or Narcan.
But there's a new name for
That's
it,
what I
right?
meant.
There's
That's
a new
what I
name for it.
There's a new name for it, but right now we're just going to talk about Narcan.
Because it reverses the effects of opiate overdose.
Yes.
Which is serious, again.
Pulp
serious
Fiction.
issue. Serious issue. No, it is
Oh,
now
that's
also.
epi. I always get that confused.
Yeah,
Yeah.
distributed through inhalation
Okay,
now. But so these opiates, they are an anal.
Anal. Speaking of anal.
Speaking of anal.
Oh. Just kidding. Not that kind of
Okay,
anal.
no.
Analgesics.
Analgesics.
Not anal.
So opioids they're derived from opium. You
Get ahead of
guys.
yourself.
So embarrassing.
It's so
Okay,
embarrassing.
so embarrassing.
So opioids come from what? Opiums?
Which also you
Used
can
to
make heroin out of it.
Right.
Right.
And that is where this little overdose is coming into place. Okay.
Okay.
So, however you say
Analgesic.
analgesic, it is used to treat moderate to severe pain management, which works by binding to the receptors for endogenous opiates. But be careful, because high doses can lead to what?
Respiratory arrest.
Which again, we are here for your everyday respiratory needs.
Yep.
Okay? So,
So keep doing those drugs.
no. If
Job security.
If taken in a high dose, it is now considered a narcotic.
Opiates.
Opiates.
So when you
Opiates.
take it, it's a narcotic.
No, because I'm not taking them in high doses.
Oh, okay.
Okay, just making sure.
That's the
Thank you.
distinction.
It's not in a high dose.
Right, you take low dose.
Moving on.
Is that what is like? Is that
And rectally. So
Oh.
it's good.
so?
Moving on.
Speaking of rectally, you can inhale them, right? You can inhale opiates.
Speaking of
Which
rectally.
is good for a cancer patient to control their pain management, but it is not good when they do have lung disease. So again, as an inhalation, that is good for us as respiratory therapists to try to get into that, field and try to manage that and try to work with that and understand the inhalation of opiates.
She's saying there's easy access to opiates.
I'm not saying there's easy access to opiates because anything that we do is not an easy access.
Right.
I'm just kidding.
So,
Do you guys know, those little pumps that the patients have now? What are they
right,
called?
the PCAs.
PCA.
But what does PCA stand for?
I was asking.
Patient controlled analgesias.
Thank
Yes.
you.
Okay, so you have this at your bedside. You have this EC axis. It's better to control than
Pain,
to
right.
what is
It's
it?
better because we're not going in there, well, not technically us, but the nurse is not going in there to administer these drugs all the time, and because pain is subjective. So we don't know when they're feeling pain or whatever. So they just hit the button.
Yeah. That's their pumps. So, okay, so we talked about Tylenol, we talked about aspirin, which is to treat your mild to moderate. And then your opiates will treat your moderate to severe, right? And so they give off their effect by binding to receptors for endogenous opioids. So that's your endorphins and your enkephalins. Okay.
Right. Encephalins.
Exactly.
And so that's like what she was saying. Your strong opioids are considered narcotics.
If taken in a high dose.
Which can lead to
respiratory arrest.
Which, again, that's what we're here for.
And so narcotics.
Okay, so,
we talked about that enough. We're done.
So just to bring back the topic of culturally felt pain, I guess.
It's like different cultures perceive.
Sorry, didn't go back. I need to go back to the angle.
Different cultures perceive pain differently. So like I can cry, no matter what. Like my dad loves me, but you know what I mean.
But my son, okay, so for example, if he falls, it's like you better get up and suck it up, boy. But if my daughter falls, it's like, oh, come here, baby. It's all right. Right. So that's a difference. So gender plays a role. So does
culture. Like with you,
and your baby. Yeah.
And your babies with the epidural.
Oh, let's talk about epidurals.
It's an anal.
It's an analgesia. It's used for treating pain locally, which has a better outcome versus pain meds that affect the whole system.
Now, epidural, most commonly used, is it? Or am I just thinking about it? Most commonly used or most heard of being used while giving labor.
That is true.
Culturally different. Pamela raised that it was okay to take an epidural. Maisala, the Mexicana, do not take a pain medication. You can have these kids naturally because for some reason, or not for some reason, but as my nurse said, taking an epidural can definitely affect the baby and they can be born high.
Explain.
My grandma told me she had 12 kids naturally. You can take this. You can do it. 17 years old, had my babies naturally, and then was given a beer.
Right.
For the pain and
because
for
you're
the
Mexican also.
Yeah. It was Budweiser. Budweiser. And it helps produce. Okay. It helps produce your milk.
Right.
My grandma is no longer with us, but she would definitely bring you one.
So, okay. Well, we do have a Kahoot for you guys.
We do have a Kahoot.
Kahoot after this. So be ready to log in with
the
your
winner
Kahoot and
will
your name.
win a bottle of
what?
No.
Oh.
A bottle of medications. So stay tuned.
Oh, right.
Try your hardest. Shoot for the stars. Unless you're high.
And for more respiratory topics, you can catch us every day at 5.
No, it's at 2.
At 2.
It's at 2.
And on our TV show called The Therapist.